本節目為醫療資訊節目，內容及觀點僅供參考，並不代表本台立場。如有任何健康疑問，請諮詢專業醫療人員。
歡迎收睇今集嘅醫護與你，我係 Christina 梁展穎，
我係馮振中醫生。每年美國都有80萬人有心臟病，咁你問咩係心臟病呢？
今日我哋好榮幸邀請咗 Dr. Cindy Wang， 佢會同我哋講解乜嘢係心臟病嘅症狀、治療方法。心臟病係全球最常見嘅死亡原因之一，唔知道各位觀眾朋友有冇試過感到胸口疼痛、呼吸困難或者輕微嘅頭暈呢？今集嘅醫護與你，我哋先會訪問心臟科醫生 Dr. Cindy Wang， 佢將會同我哋探討心臟病嘅徵兆同埋風險因素。之後，我哋會帶大家參觀 Camino Mountain View 醫院裏面嘅急症室，睇下醫療團隊點樣為一名心臟病嘅病人急救嘅模擬片段。喺我隔離咧就係 Dr. Cindy Wang。Cindy 你好，我哋咧好想知道究竟點解咁多人喺美國有心臟病，究竟係乜嘢症狀呢？
It's the number one disease in America in a lot of countries. Part of that is because of the way our lifestyles are and how we take care of ourselves. We tend to have a more rich diet in the United States, so there's more development of plaque. We tend to be more sedentary in our country as well, so that leads to, higher weight gain and more problems with our blood sugars.
And can you tell me why there's so many Asian communities also have heart attack?
Well, I think one reason that I see is that in general, Asian people may not be as aware of the symptoms of heart attacks, or more commonly, they don't respond to symptoms when they notice them. It is important if you ever experience symptoms like shortness of breath, chest pressure, and especially if you do these with activity, that you seek medical attention for it. There have been several times that I've seen people present with a heart attack later on, almost too late in the process, and it's sometimes difficult for us to use any of our modern treatments and interventions on people when they show up later.
咁我知道咧，好多人咧都係譬如話覺得心臟有少少痛啦，咁都話不如我哋休息一下，或者瞓一下、唞一下、飲啖水先。咁其實係咪應該要即刻去尋求協助咧，定係我哋唞一下就冇事咧
？Very good question. I think that's a very important message to bring to the Asian community because we tend to minimize our symptoms and we tend not to be people who complain about things. But if you do ever experience things like you mentioned, especially chest pressure, it may not be very intense or sharp. It usually is a more dull, pressure-like sensation. Some people have described it as an elephant on their chest, or that they needed to open the window to get a breath of fresh air. If you notice these things and they don't go away, you should go to the emergency room right away.
究竟男女嘅症狀係咪一樣呢？男人多啲定女人呢？
Yeah, I mean, both genders can have atypical symptoms. I think women may have slightly different symptoms, but everyone should be aware of both typical and atypical symptoms. Less common symptoms probably are indigestion or like a burning feeling that may be lower, like in the stomach. Anytime pressure or pain travels to different parts of the body, very commonly the left arm or the jaw, you should go seek medical attention immediately. The worst situation is if you feel pain traveling to both arms or possibly going to your back. You may also have symptoms like shortness of breath, feeling nauseous, vomiting, or having skipped heartbeats. A less common presentation is also that you could possibly faint if it's very severe, so losing consciousness or blacking out.
剛才江醫生提及心臟病嘅症狀，包括心口有壓力、疼痛、痛楚延伸到左手、腹痛、呼吸困難、呼吸急促等等。各位觀眾朋友，假如你有上述嘅症狀，請立即去求醫。歡迎收睇醫護與你，呢一節我哋會訪問一名 Camino Mountain View 醫院工作嘅急症室護士，之後會帶大家入去急症室睇下醫護團隊點樣盡心盡力咁為病人急救嘅模擬片段。
Yeah, I'm Jean Smith. I've been a nurse here at El Camino for the past 3 years. I like that it's a community hospital. We get to see a lot of the same patients. The crew here is great, and we have a lot of good resources here that we can give to our patients in the community.
要成為一名急症室護士並唔容易，除咗要熟悉急救技巧同埋各種醫療病症之外，仲必須具備隨機應變嘅能力，因為緊急情況往往都係最意想不到嘅時候發生。
Do not hesitate to come into the hospital because we never know what it is until you get it checked. Something that you think might be more minor, the quicker that we can get you taken care of, the better. It saves your heart, it saves your brain, it saves everything.
為咗更深入了解醫療團隊點樣全力拯救病人，我哋而家先睇一條關於心臟病急救嘅模擬情景。
We have a 65-year-old female coming here with chest pain, 10 out of 10, sharp radiating to the left arm. She's on O2 for comfort. This is one of the worst pains she's ever had. We're going to move on 3. 1, 2, 3.
Any history?
History of CHF and IV.
Ma'am, how bad is your chest pain right now? Ma'am? Really bad? Have you ever felt this before?
I'll come to the other side.
Do you have allergies to anything? An antibiotic? Have you taken anything for pain today? What's your medical history?
Okay.
Pre-diabetic. Do you take medications for that?
Just going to do a quick EKG on you, okay?
We're gonna have you lie still and quiet while we're doing the EKG, okay? We're gonna put you on some oxygen
1, 2,
for
3,
comfort.
Big pull.
Do you have any family history
I have an
of anything with your
18.
heart?
And the right AC.
18 right AC. No family history. What does the chest pain feel like? Heavy. What time did it start? 9. What were you doing at the time? Sleeping. And it woke you up? Nice slow deep breaths, okay? Okay, doctor, we have the EKG ready for you. So this is a 65-year-old female, chest pain, 10 out of 10, started at 9 this morning. She was sleeping, it woke her up, described as heavy. She is just pre-diabetic. She takes metformin, no, an allergy to an antibiotic, but she cannot remember the name.
How are you feeling?
Not well.
Okay. Your EKG looks concerning for a heart attack. Based on what we're seeing on the EKG, we'll need to take you to get a procedure done immediately so that we can open up the blood vessel again. Are you okay with that?
Yes.
Ma'am, are you okay? Are you okay?
Are you okay?
Anybody have a pulse? No pulse? Start CPR.
We have a BVM.
Compression started at 9:56.
9:56. We lost pulses at 9:56. We started compressions. Is there any medications you'd like us to prep?
Yes, are we getting a rhythm on the monitor?
We have not done a rhythm check yet.
Check pad.
Looks like PEA.
Okay, let's give epinephrine.
Epi in. Epi in. Okay, it's about 15 seconds to the next rhythm check. Somebody holding pulses.
Let's check for a pulse.
Okay, stop compressions.
Stopping compressions.
Any pulse? No pulse. Okay, resume compressions.
Continuing.
Let me know when you need to switch
Looks
out.
like our rhythm is PA. We'll give another round of epinephrine.
Second epi's in. Second epi in. Okay, it's been another 2 minutes.
Okay, let's check for a pulse.
Any pulses?
Got pulses back.
Okay, what's the rhythm on the monitor?
It's like normal sinus on the monitor.
Normal sinus. Can we get another EKG? Where's the cath
Yes.
lab team?
The cath lab's ready to go.
Perfect. Let's transport her up.
I mean, technically.
剛才我哋睇到急症室嘅醫護團隊點樣盡心盡力咁診斷同埋搶救病人。當病人出現心臟停頓嘅時候，醫護團隊會立即展開心肺復甦法，分秒必爭咁進行急救。拯救一條生命，絕對唔係單靠一個人就能夠完成，而係整個團隊堅持努力、分工合作而成。
每年美國有80萬人有心臟病嘅，咁樣你哋會問點能夠可以一早就知道去診斷同埋做好嘅嘢，阻止壞嘅事發生呢？
So usually the diagnosis of a heart attack starts with an electrocardiogram or an EKG. This is when we put electrodes on the chest and run an electric almost picture of your heart. This can show if you've had old heart attacks, if you're having a current heart attack, any rhythm irregularities.
汪醫生話：心電圖就好似對住你嘅心臟影相一樣，可以睇到病人有冇曾經心臟病，或者正在心臟病發，或者心律不正嘅情況。為咗更準確咁測試病人嘅心臟，病人可以做一個壓力測試，叫 stress test。
We have several different types of testing, including nuclear stress testing, or even doing a coronary CTA, which is a type of special CT scan of the heart that looks at the blood vessels.
當佢譬如佢家庭有個心臟病嘅原因，爸爸媽媽或者祖父祖母，咁佢嘅 chance of 有心臟病係咪多啲呢？
So for cardiology, we consider an early family history of heart disease to be any male immediate family member. Any age greater than 55 is considered early. For women, that age is 65.
汪醫生提到，如果家族中有心臟病嘅病史，會增加患心臟病嘅風險，所以必須做身體檢查同埋預防性治療。
如果真係有心臟病，咁樣點樣醫療呢？
We can get into the blood vessel and open it up using a stent. Nowadays, the priority to get to a cardiac catheterization lab, that's where we do our angiograms, is to get there in less than 90 minutes from the time you arrive to the door to when you get your stent placed. It's more common also for the interventional cardiologists to use intravascular ultrasound to help know where they should place the stent, how long it should be, how open or dilated they should open up the stent. And so they can use precision to place that stent and know where it should go. We do have older therapy called thrombolysis, which is when we give a medication to essentially break up the clot. But I would say that this is seldomly used in any hospitals anymore. After we do the coronary CT angiogram, we will do a technology, artificial intelligence technology, and we can use these to validate our understanding of the significance of the blockage. So the doctor will evaluate by eyeball first, but then we'll use artificial intelligence to validate that understanding.
汪醫生提及，當一個人心臟病發嘅時候，醫護團隊會立刻送病人到導管室打開血管。喺進行 CT angiogram 嘅攝影後，醫生會透過人工智能嘅科技嚟評估病人血管阻塞嘅嚴重性。
經過呢個心導管係成功嘅話，咁個病人就應該點樣處理呢？
Yeah, so immediately after having a procedure like this, it's typical for patients to be monitored in the hospital for 2 days, a few days, depending on how sick you are after the procedure. That's the time where we will add a lot of good medications to help strengthen the heart, keep the stent open, and to change your risk factors. Most people who develop heart attacks have high cholesterol, high blood pressure, diabetes, or elevated blood sugar, and we use this time to optimize a lot of these risk factors. We also want to make sure that things like your rhythm, your symptoms, and your overall condition are significantly improved compared to when you first walked into the door.
汪醫生話：當病人出院後，參加心臟復健係非常重要。Camino Mountain View 醫院有完善嘅康復運動設施，讓病人更快康復到原本嘅健康狀態。
The next few weeks after a heart attack are very critical for your heart health and improving your symptoms. So we usually ask that people will stay active, but will wait on their exercise and slowly increase that over time. 剛才汪醫生提及心電圖嘅好處、唔同類型嘅心臟測試，以及治療心血管疾病嘅手術同藥物方法。喺呢一節，汪醫生會同我哋分享預防心臟病及最新嘅研究。黃醫生啊，頭先你講咗好多心臟病嘅症狀啦，同埋治療方法。咁究竟你第一次有心臟病發之後，會唔會有再次發生心臟病嘅呢？ Yeah, so unfortunately, after you have a heart attack, it's still possible for you to have another one. And if anything, now we know that there's plaque in other locations, so those can always be problematic. The best thing to do is to reduce your risk factors for that. Like we talked about previously, that we need to control your blood pressure, control cholesterol, try to get areas of plaque to consolidate or reduce, and also engage in a healthy lifestyle through eating and exercise.
各位觀眾知道有啲好特別嘅嘢可以做個心電圖㗎，或者你嗰個 Apple Watch 個錶係咪可以做個心電圖呢？嗰啲係咪好正確嘅呢？ Are those reliable?
Yeah, so usually in the office, we will use what are called Holter monitors. The ones we use now are called either Barty monitors, which are long and skinny, or Zeo patch monitors. These are sticky types of EKG monitoring. There are more accessible wearable devices to patients, which include the Apple Watch, and also there's a type of device called a Cardia device. These can all be very helpful for rhythm monitoring. They're not as good as the patch ones, but it's the easiest way for patients to kind of basically get better control over their own health and monitor their own health at home, which a lot of patients like. I would say it's very good for rhythm monitoring, but it can never, at this point, tell if you're having a heart attack. So you should not rely on your device for things like that. But it's very good for rhythm issues like atrial fibrillation, atrial flutter, and other arrhythmias.
目前市面上有好多心電圖監測裝置，例如蘋果手錶。不過民眾唔應該完全依賴呢啲裝置。
有好多人都驚住咧，有 pacemaker 啦，就唔可以經過機場嘅檢驗啊，或者唔能夠有 MRI。So are there any precaution if a patient has a pacemaker? They should not go through certain devices or certain procedures?
Yes, so when you have a pacemaker, right, which is a type of device that supports your heart rhythm when you're unable to, traditionally you could not go into an MRI machine, for example. Modern technology has allowed these devices to change, and many devices are what we call MRI conditional, which means that they can go into MRI magnets. So.
Or MRI compatible, right? Okay, good.
咁唔知道黃醫生你有冇試過喺街度會撞到你啲病人嘅咧？
Yes, I have, and I will say that technically, according to our rules, we're not supposed to approach our patients when we see them in the grocery store, so don't be offended if your doctor doesn't say hi to you. But if you approach us, we're very happy to talk to you. And so yes, that's happened before, and it's always good to see people outside of the office and living a healthy life and doing what they normally do.
咁黃醫生，我哋講咗咁耐啦，咁其實你係做咗咁耐醫生，你覺得最感人或者最難忘嘅故事係乜嘢咧？
The most memorable patients are probably from when I was in training in San Francisco, and helping them through angina, through procedures, and overcoming obstacles with heart surgery. And they are patients that remind me of my own family, and just the way their personalities were. And so walking with them through their medical issues, I'll always remember them in my career.
醫生呢個行業真係唔容易。汪醫生話好多時候見到病人就會諗起自己嘅家人，能夠陪伴病人一齊面對醫療上嘅挑戰，對佢嚟講係一個好大嘅成就感。咁好多謝黃醫生同埋馮醫生今日同我哋分享咁多寶貴嘅心臟嘅知識。假如大家有咩醫療嘅問題嘅話，請去以下嘅網站，你可以留言啦。下次再見。
再見。